Good afternoon. Welcome to Marketplace 5. I'm Jessica Taloni, and joining us today is Dr. Barry Rips of NewLife Fertility Practice. And we're talking about infertility and most importantly, not waiting to find the problem.
Right. It's unfortunate, but many people hesitate to seek care for infertility. And unfortunately, that's the worst thing to do because time is the one factor we really can't fix. We don't have a way to make people younger yet, you know?
Yet.
But one day maybe. And so if people will, who are suffering from infertility seek care, they'll usually be able to find a diagnosis and find effective treatment. You know, and it's understandable. People have a little anxiety about seeing a new physician for the first time, and they're probably comfortable in the OB/GYN setting, but they don't realize how fast they can move and towards success by making that first step.
And perhaps one thing that would make people more comfortable is if they knew what to expect, maybe at that first visit. What should people expect?
Well, nowadays, fortunately, most of the paperwork is done in advance online. So no one's waiting in the waiting room with a clipboard trying to fill out paperwork. So when they come in for that first consultation, we can make a lot of progress. We have most of the information we need to start testing and begin treatment.
And you had mentioned before that insurance often covers that initial testing.
Right, so there should be no hesitation from that perspective either. And most patients find that first visit is informative and interesting. And usually by the end of the first visit, they're laughing about some myth or mystery about where babies come from. It's a comfortable experience. There shouldn't be fear on that, from that perspective.
And one of the things you've told me is that 90% or more than 90% of couples that see you and do this fertility testing wish they had started sooner.
That's true. The surveys show that people who have been through the process of testing and treatment, in retrospect, the majority would say they would have gotten started sooner. And that's critical because our therapies are not as effective as women get older. The age effect is more powerful than our treatments.
And there's a lot of anxiety and stress that goes along with infertility. Tell us how that plays a role.
You know, some people, our patients have complained that sitting in an OB/GYN office is so uncomfortable, so many pregnant women. In our office, they're sitting with other women who are facing the same challenge. They realize they're not alone. That is comforting in itself. We have a Facebook page where families and family members and friends will be supportive. It's a social place. We also realize that for some women, the anxiety is just too much. It's interfering with therapy. It's interfering with the success rate. For them, we offer counseling, and that's also very effective.
It's a large community of women that can get together in that kind of a setting.
Yes, very
well,
helpful.
if you'd like to reach Dr. Barry Rips, you can find him on Facebook, as he mentioned. You can also check the website out, fertilityleaders.com. For Marketplace 5, I'm Jessica Taloni.
New leaders in fertility and endocrinology. New Life. Call our office right now for more information.